My name is Dr. Triton Krizenesky. I specialize in internal medicine over at the Bellin Healthcare Clinic. I like internal medicine in the fact that it focuses on a little bit of everything. My days kind of vary. Some days it'll be a lot of respiratory issues. Other days will be a lot of GI issues or liver issues, kidney issues a different day. So every day is a little bit different. Every patient has a little bit different focus that they need. I think one of the big things that I do is I'll offer all the solutions that I know, the potential steps that we can take to work up a problem, solve a problem. It very much depends on what my patients are comfortable with. And I think that's one of the reasons why people like me as their provider, because I take the time to figure out what works best for them and then kind of moving forward from that. I give them my thoughts, but ultimately I respect what they want to do and go from there. My wife and I we're both from Appleton. I did my undergraduate in biochemistry over at UW Stevens Point. I did my internal medicine residency training over at Southern Illinois University in Springfield, Illinois. During my residency training and even medical school, I would use the phrase up north and people would have no idea what that meant, so I'm glad to be back. If we look from the scope of coming in for a physical, you haven't seen a doctor in a long time. A lot of it is based on how the patient wants to approach it. We talk about a lot of the preventative medicine things, routine cancer screening, healthy diet and exercise, those kinds of things. So there's always a next step, and that's something that I think is very important for my patients. One of the things I don't want them to feel like is like, oh, I had this appointment with this doctor and I don't really know what's happening and I don't know what to do from here. It's nice to be able to be that person to help a patient with the medical issues that they have, something that they may not be completely comfortable talking to people about, but yet they come into a medical office saying, hey, I have this problem, I have this concern, where do I go from here? And I think being able to guide my patients through whatever they're dealing with is probably the most rewarding thing for me.